Most of us are all too familiar with a painful burning sensation in the center of the chest that's usually associated with heartburn. In fact, up to 28% of adults in North America experience gastroesophageal reflux disease. It is a common condition that causes heartburn. This occurs when acid is pushed up from the stomach back into the esophagus, which leads to the heartburn sensation. Although people often use medications to treat acid reflux and heartburn, many lifestyle modifications can also help you reduce symptoms and improve your quality of life. So here are several ways you can get rid of acid reflux quickly and naturally. Changing your dietary habits is one of the most effective ways to reduce acid reflux and heartburn. Avoiding dietary triggers such as spicy or acidic foods can help alleviate acid reflux. Baking soda helps to neutralize acidity and can be dissolved in a teaspoon of water for temporary relief. Additionally, drinking an apple cider vinegar and water mixture before any meals may help reduce symptoms. Many studies have shown that chewing gum may help decrease acidity in the esophagus. Gum that contains bicarbonate appears to be especially effective, as it can help neutralize acid to prevent reflux. Chewing gum can also increase saliva production, which may help clear the esophagus of acid. Several studies have also found that sleeping on your right side may worsen reflux symptoms at night. In fact, according to one study, lying on your left side may decrease acid exposure in the esophagus by up to 71%. This solution could be explained by anatomy. So the esophagus enters the right side of the stomach. As a result, the lower esophageal sphincter sits above the level of the stomach acid when you sleep on your left side. On the other hand, when you lie on your right side, stomach acid covers the lower esophageal sphincter, increasing the risk of reflux. While sleeping on the left side all night may not always be possible, it could help make you more comfortable as you fall asleep. Some people experience reflux symptoms during the night, which can affect sleep quality and make it much more difficult to fall asleep. So by changing the position that you sleep, by elevating the head of your bed, could help reduce symptoms of acid reflux and also improve sleep quality. One review of 4 studies found that elevating the head of the bed decreased acid reflux and improved symptoms like heartburn and regurgitation in people with gastroesophageal reflux disease. Healthcare professionals often advise people with acid reflux to avoid eating within the 3 hours before they go to sleep. That's because lying horizontally after a meal makes digestion more difficult. Eating a late-night meal can increase acid exposure when lying down by 5%, compared with eating earlier in the evening. Several studies, including people with type 2 diabetes, found that eating dinner late at night was associated with a higher risk of acid reflux. Raw onions are a common trigger for acid reflux as well as heartburn. More frequent burping might suggest that more gas is being produced. This could be due to the high amounts of fermentable fiber in onions. Raw onions are also more difficult to digest and might irritate the lining of the esophagus, causing worsened heartburn. Whatever the reason, if you think eating raw onions makes your symptoms worse, you should avoid it and opt for cooked onions instead. Also, eating several smaller meals throughout the day, rather than few large ones, can help reduce the symptoms by preventing overfullness in the stomach. Losing weight, if necessary, and quitting smoking also help reduce acid reflux. The combination of these remedies can be quite effective in reducing heartburn. There are other remedies that can help soothe the irritation caused by acid reflux and heartburn. Drinking milk can help provide temporary relief. However, if you experience more heartburn after drinking it, it is best to avoid it. Aloe juice is also helpful for soothing skin sunburns and providing relief from heartburn. Citrus juice is also known to help in some cases, but may also cause acid reflux in others, depending on the individual's reaction to it. To reduce acid reflux, avoid trigger foods that cause painful burning sensations. Remember, common triggers include spicy foods, caffeine, and alcohol. You can also try adding ginger to your diet, as it has been known to soothe stomach aches and nausea. Additionally, it may reduce the stomach acid that causes the burning sensation in your esophagus tube. So try drinking ginger tea or taking a product containing ginger extract before any meals to help alleviate pain and discomfort caused by acid reflux. People who suffer from heartburn should also try to avoid stress, as it's considered a major trigger for acid reflux. Genetics can also play a role in the development of acid reflux, but many things that people eat can also cause it. The diaphragm is a muscle located above your stomach. Normally, the diaphragm naturally strengthens the lower esophageal sphincter, which prevents excessive amounts of stomach acid from leaking up into the esophagus. However, if you have excess belly fat, the pressure in your abdomen may become so high that the lower esophageal sphincter gets pushed upward, away from the diaphragm support. This condition, known as hiatal hernia, is considered the leading cause of acid reflux. So achieving and maintaining a moderate body weight can help reduce acid reflux in the long term. If you're interested in this approach, make sure to speak with a healthcare professional to assess whether it's right for you, and if so, how can you lose weight safely and sustainably? Many over-the-counter medicines are available to treat occasional heartburn. They include medicines that neutralize acid in the stomach, block the flow of stomach contents into the esophagus, or decrease fluids that's produced in the stomach. These medicines work well for people who have heartburn sometimes, but if you find yourself using them more than twice a week, you should contact your physician. Chronic heartburn can damage the esophagus lining, narrow or cause an obstruction of the esophagus.